Link on mail. Which link, ma'am? Eh, yes, ma'am. Yes, ma'am. I have shared it on WhatsApp, ma'am. The link.
Hi everyone.
Hi.
Hi Elaine, how are you? Oh, you're on mute, can't hear you. Yes.
Yeah, it's okay.
Yep,
Yeah.
better.
How are you?
I'm good. How have you been?
Fine, thank you.
So, Dr. Chinmay, how many people are we expecting to join us today?
Ma'am, will join, ma'am. I don't know how many will join, but
Okay.
it is free. I have not made the registration also, so
Okay. All right.
we'll see.
Yeah.
We will start in 2 to 3 minutes. We will start.
Yes.
Yeah. I have actually invited gentle lady from Tunisia. She's
Okay.
connected now. Yeah,
All right.
we have. She's connected. We can see her, but she's connected now.
Yeah,
You
hi
can
everyone.
introduce yourself. Yeah.
Thank you. Okay, thank you for being supportive and letting me enjoy and reach out this event with you, especially today. So I present myself. I'm a pharmacist, and at the same time, I'm working as a PV specialist in Sanofi. So I hope after this meeting and after sharing different perspectives, we will amplify global understanding of patient safety and pharmacovigilance and so on.
Yeah, that's amazing to know. I mean, I think we are all
Welcome to-
here to inspire each other, to motivate each other, and at the same time create awareness is what needs to be done globally. So great, welcome.
Yeah, thank you.
Good evening, everyone, and good morning, good afternoon to everyone. So we will start this event today. We will wait for 2 to 3 minutes, then we will start at 7:05. So it is just 7 right now.
Yeah.
So many are joining right now, 12 participants. So many will join.
Are you going to record the meeting, Dr. Maya?
Yes, sir, it is on record and it is live on YouTube.
Okay, thank you.
Yes, sir.
Hello, everyone. This is Josue from Mexico.
Yeah.
Hi.
How are you?
How are you?
Good morning. Good morning, Doctor.
Good to have you again.
Yeah, good morning, good afternoon, good evening.
I can hear a young enthusiast as well.
Yeah, it's my son.
Nice, nice. You learn about patient safety early.
Thank you everyone for joining. A warm welcome to all of you to the first event of Global Pharmacovigilance Society. So today we are going to celebrate the World Patient Safety Day as WHO is celebrating for in the year of patient safety. So actually today we have a agenda like we will launch our 1% 1 PV e-card system. I will tell the brief regarding that, means how and what we have to do and how it will be beneficial to the others. Then we will launch the training program in pharmacovigilance that is in collaboration with Vigisar Foundation, the founder of the Vigisar Foundation, Dr. Manoj Swaminathan sir. Then followed to that, we will announce the results of the international pencil art competitions that we have organized and in last 10 days in collaboration with Mexican Pharmacovigilance Society. Then from Armenia, that ETL company, then Samogen, and from that Colombia Association of Pharmacovigilance. So we have so many participants has sent their drawings. Right, about 32 drawings I have received, and few of them have got rejected because they have not focused on the pharmacovigilance aspect. So they have got rejected, and rest of all I have sent for evaluation, and based on evaluation out of 13 responses, 13 responses, we have decided the final means winners, who will be the winner. So at the last, I will announce their names, and the certificate will be distributed to them at 8 o'clock. So at 8 o'clock, they can get their certificate. So let's move to the first launching of our program. So I will share my slide, and I will just briefly, I will tell about the things, what it is. Once again, a warm welcome to all of you, as few have joined currently right now. So today, this is on the eve of World Patient Safety Day. Our society, Global Pharmacovigilance Society, is going to launch One Patient, One ePV card. So in this card, we have kept a few areas where the patient has to enter few informations, and then we have to go through that, and then we have to generate the card and send it to the registered email ID. So how it will go means, what will be our aim? So our prime aim is to help patient in identifying ADR or adverse event or side effects. The second aim is to provide them a ePV card with unique worldwide number. So it will be a unique worldwide number. The barcode will be generated, and the number will be also generated, and it will be printed on the, it will be kept on the card. Then the third aim is to help the physicians to understand about patients, because sometimes what happens, the patient won't be able to express his views, his thoughts, or his history. So sometimes the patients who are challenged, like they can't speak. So in that case also, they won't be able to express um, um, their disease or their whatever drug they have taken, whether they have got any adverse events regarding that or not. So they could not express it to the physician. So the physicians may write the drug which may produce the adverse event to the patient again. So we have to stop the re-administration of the drug that may cause the ADR. So the final aim is to help the patient who cannot speak to a physician. Sometimes they can't speak because of fear or something like that. So how it will go? The patient has to log into www.globalpvs.com. This is our website. Then after that, there is a at the top right corner, it is there, programs active under PV Society. Then he has to click here to apply at the below. Then he will go to a Google form link. So that will open, and the first question will be asked, like, have you ever suffered from side effect or adverse event or adverse drug reaction due to a drug? There are two options. One is yes or no. So if the person enters yes, then he will go to the section 2. If he answers no, then he will go to the section 3. So in section 2, we have kept the informations regarding ADR or AE or side effects. The informations we are going to collect, like indication for which the patient has taken the drug, then which drug he has taken. It could be, he can write the generic name or branded name, whatever he wish, he can write. The dosage form, the tablet, capsule, or injection, or parenteral, or transdermal patches, or whatever route they have taken. So they have to enter that one. Then the ADR or side effect, what has happened to them, then their severity, whether it is it lasts for a long time, or they can write it in a paragraph format, or whatever they wish they can write. And the severity, it will be 3 major, minor, or moderate, like that I have classified. So they can click on that. Then the recovery status, whether the patient has got recovered from the adverse events or not, they have to mention that. Then the de-challenge test and re-challenge test, it is like stopping the drug and observing the effect, whether the patient is getting recovered from the adverse event or not. And then the re-challenge, whether the patient has been that whether he is getting the adverse event again and again, like that. We have kept few questions, so they have to enter there. Then the third section, whoever has entered no in the first question, so they will go to section 3 directly, and there they have to enter the few details like patient history, like they have to enter the information regarding ADR or AE or side effects in past or childhood, like last year or a long back, last 5 years or 10 years back. If they have got any kind of adverse event, then they can also enter the information, and information about allergy like sulfa drugs or some other food, any drug related, any allergies if they have, they can enter. Then the adverse event due to long term use of drug, that is a very typical, because few patients are there who are on the anti-hypertensive drug for a long time, but they don't know from when they have started the taking the drugs. So that's why we have to maintain a card system or diary system like that. Then we can monitor it properly, and we can come to a conclusion. So that's why I have just kept the few questionnaires I have kept here in the section 3, which the patient has to enter. Then going to the section 4, we will collect the personal information like email ID, name, gender, age, and country details. So no any other personal information are going to be collected, and the email ID, whatever we have collected, we will send the EPV card to that email ID only, the registered email ID only. So that is how it will go. So after filling all this form, the patient or any legal representative or any family members on behalf of the patient, they can enter this form, and they can fill this form, and they can submit. So once they submit, it will come to us, the information will come to us, and then we will process it through the coding and all these things, the coding of the 8 or and the drugs, etc., etc. So we will enter it, and we will evaluate that one. Then we will generate a EPV card for them, and within 10 days they will get their EPV card in their registered email ID. So this is how it looks like. So worldwide unique card, and the barcode will be at the left side, and the person or the card, if it gets updated, then upgraded, then it will go on changing. So that is there. Then the patient details we will enter here. Then the patient history, the disease in the past, drug taken or side effect, and the current information, like currently if within 1 month or within 2 to 3 months, or last 2 to 3 months, or last 6 months also, or last 1 year also, if they have got any kind of adverse event and they are on the drug, then they can enter the data, and they can get their card, EPV card. And we have kept the renewal system, like within 1 year, after 1 year they can renew the card, or else if they are getting any adverse event due to any new drug, then they can also inform us, and we will issue them a new EPV card. So that is the process, how it will go. And finally I would like to tell that this information is the Global PV Society is not responsible for any falsified information provided by the applicant, and the use of this card is purely voluntary basis for patient safety. We are not going to take anything from this. We want to help a patient to understand and to stop taking the drugs that may cause adverse event or may cause harm to him. So that is our prime aim, and that is our focus. And it has not been certified by any regulatory agencies, and the patients can use it while visiting a physician as a tool for self-protection. So this card they can take with themselves while visiting a physician, so that the physician will get to know that yes, we should not write these drugs because it may cause adverse event to this patient. So that is the main aim. Thank you for patient hearing, and this is what I would like to present it today. And now I would like to invite Dr. Maya Sharma, who is the president of this Global Pharmacovigilance Society for India. So I would like to invite him to address the gathering today. Thank you, ma'am.
Hi, thank you so much, Dr. Chinmay, for the faith entrusted upon me, and thank you everyone for joining. I would just like to say that all of us here are not doing a job. We are actually serving a purpose. We want that the faith on medications should be increased. And if we want to have that confidence and trust on the overall system, whether it is on pharmaceuticals, whether it is about regulatory bodies and government, then we have to join hands with each other and generate data. The more the data, the more there will be things to talk about, evidence-based data and evidence that we are collecting. And it's great to see that, such bright minds from different parts of the world are, here today to share that purpose, to work towards that cause. And highlighting that, most of us who are here are mostly coming from emerging economies and developing markets. And that is why I would like to reiterate that, it is not about a US or a UK MHRA or a US FDA. All of us can actually work towards that cause. We belong to countries which have, a major portion, a major fraction of the world's population. And that is why, we have to think again and again and work that, are we contributing so many cases to WHO when we talk about pharmacovigilance? Like if I have to give example of India, India is a nation of 1.3 billion people. And I question every time I take a presentations that 1.3 billion people means we are 1/6 of the world's population. So are Indian authorities or are the Indian healthcare professionals here are able to contribute 1/6 of the world's cases, when it comes to the record and evaluation and analysis of those? The answer is no, right? So that means there is a lot of work which needs to be done. And even the data which is available from the developed nations, even those countries say that it is only 6 to 10% of the cases which are reported. That means it's a long way ahead of us, which needs to be covered. A lot of sensitization needs to be done, awareness needs to be created till we are able to cover all the healthcare professionals. And I would highlight healthcare professionals are not just the doctors, but also the nurses who are administering the medications inside the hospitals, giving IV in ICUs. There are a lot of other technical staff, paramedical staff inside the hospital, which can have access or they can recommend medications. So unless we are covering each one of them, all the nurses or midwives, and we are creating awareness, we are coming up with a system where these people are evaluated on their knowledge of pharmacovigilance. Unless we are training them on what are the available forms and formats and who is their go-to person for pharmacovigilance. So unless all these nuances are taken care of and the system becomes more proactive rather than reactive in nature, I think till then we are not successful. So that is why, let us work in this direction, share the best practices. If any one of you has any idea that what is already being done or a new idea that can be implemented and, can be made operational in other countries as well, then we'll welcome that idea. I would say Dr. Chinmay is doing a wonderful job coming up with newer ideas and seeking validation from all of you so that we can see that how we can progress together and make this dream of patient safety a reality. So that is all I wanted to say. Thank you so much, Dr. Chinmay.
Thank you, ma'am. Now I would like to invite Dr. Luca Cariolato, sir, from Switzerland to say something regarding patient safety.
Hello, good morning. Can you hear me?
Yes, sir.
We can hear you, but we can't see you.
You can't see me. Yeah, it's no, probably you can see me. I think no, not yet. So just I try to speak, and if you see me, yeah, okay.
Oh, yes, much better.
Yeah, for me, it's always a question about safety to understand what we are looking in terms of data. More and more, we have more and more data. And the point that I'm asking, how we should look this data. And I'm afraid that sometimes we look too many details, but we lose the big picture. Big picture regarding the risk, which kind of risk, how we have to minimize the risk, and also what are the risk factors, because often we make a confusion between confounding factor, contributing factor, and we provide an assessment. Sometimes we don't have time because we have a regulatory submission, and we lose sometimes the meaning. So it is important for me that safety concentrate not only on regulatory, but really come back to the origin, patient safety. And patient safety, sometimes we know it takes time to understand why certain patient experience event and other do not experience event, or in a different form. So for me, it's important to collect the data and to analyze in a proper way. So every activity that try to address this point and try to keep an history of the patient is the most important to minimize then the risk, because there is no safe drug. If a drug is safe, it means that it's not efficient for me in a way, because if there are no adverse events, there is no effect. So the effect must be minimized, and how we minimize, only knowing the history of the patient or the predisposition of the patient about his medical history and risk factors. So the PV card is good to understand which are the risk factors, and then to try to understand which are the risk factors, which are the patients are risk to develop the risk that affect the benefit risk balance. So this is my point. So in PV, more and more we will have more data, this for sure. Now we have to understand how to analyze this data without focusing on the important activities, and not to lose our mind behind events that in a way do not suggest anything in terms of safety, or are just part of bigger risk that we are not able to capture. And this we put in dangers. It's a paradoxical effect that we put on more danger the patient, if we don't understand why this patient experience event and what are the real risks behind certain symptoms.
Thank you, sir.
Sure.
Thank you.
Thank you.
He is going to lead this our society at Switzerland. Now I would like to invite Dr. Jos Batista sir to say something. He is the president of Mexican Pharmacovigilance Society in Mexico, PV Latam area. Hello. I think,
Oh, it seems he's not there.
yeah, he was there, but now
I think maybe he just dropped out.
okay, no issues. Sir, now I would like to invite Dr. Rajendra Jalali sir to say something. Sir, please unmute, sir.
Hi, good evening, everyone.
Hi, good evening.
It's a pleasure to be with all of you. And I must really congratulate Chinmaya and team for coming up with brilliant ideas to improve the patient safety.
Thank you, sir.
And that's what he has now come up with, the one patient, one safety card. So I would like to have one or two comments.
Yes, sir.
So one is that how is the system aligned with the current practices or current, currently they are being reported? That is one. And because our objective is to boost the patient safety, there are so many organizations, so many, partners that are doing this, of
Yes, sir.
strengthening ADR reporting globally.
Yes, sir.
So that is one question. And second is that maybe I have missed, is it an electronic card or what type of a card it is?
It is a simple PDF format. It will go,
Okay,
sir.
okay. Number three is that, as the advances go day over day,
Yes,
I
sir.
think Ministry, Government of India, Health, they have released an app-based, an app which will be both for patient and doctor reported. So these are the three comments, and I really compliment your efforts, team's efforts to build the patient safety.
Yes,
Thank
sir.
you.
Sir, actually, sir, many are working in this area. I know that, sir. But our main focus will be direct contact with the patient, sir. So we have gathered many information from healthcare professionals, but still today patients are not yet started reporting ADRs. Very few, means if you can go and see the proportion also, it is very less, sir. So we have to include them into the system, otherwise the system will collapse someday. Other means only healthcare peoples will report, but the patient, they are not aware of what it is. So that's why this card, I think it will create a awareness, some kind of awareness, and it will help them to understand something, that yes, something is happening. Because in a medical store also, if we visit, then the people are saying many patients are getting adverse events, but they don't know what to do after that, means whether to report somewhere, or whether to tell someone. Though they tells it to a chemist at the medical store, then they won't be able to send that information to regulators. So it is a loophole, sir. So we have to think, this means I've just started to initiated these things to bring these patients into this umbrella, so that they can participate also, and they can start reporting. So that is the main thing, sir. So on behalf of patients, if the patient is not interested, or he's a small kid, or he's disabled patient, or physical challenge, or mentally challenged, whatever it may be. So on
Yeah.
that case, their family members, they can make a card, and they can tell them to keep that card with themselves, and whenever they visit to a physician, they will take that card, and it will be a mutual benefit for the patient and the physician also. Physician will get to know that yes, this drug is causing the harm to this patient, so I won't write this again. So that kind of information, it will save the time. One part of it, where it will save the time, and history also, if the physician will go and see, then it will be helpful for them also to judge and write the correct medicine to them. So that is the main thing, sir, what I've thought, and I have started. Let's see how it will go.
No, exactly. I also second Dr. Chinmay on that.
Yes.
Because if we have to make this program a success, that means all of us are reaching out to healthcare professionals. We are first creating awareness at that level, telling
Yes.
them that how they should be sensitizing the patients about this card, right? So that means healthcare professionals are taken care of. And
Yes.
once the patient have this, so it becomes a tool for their empowerment, and they become part of the pharmacovigilance system. They become an active participant of that. So yeah, that way it is going to have a two-pronged approach and work at both levels.
Yes.
Thank you.
Thank you, sir. Now, who are they? Dr. Avinash, sir, are you there, sir? Would you like to say something? Hello? Hello, Dr. Avinash, sir? Okay. Now I would like to invite Patricia Juliaga from Colombia to say something regarding patient safety. I think she is going to lead this society in Colombia. Are you there, ma'am?
Hello, good morning.
Yeah.
Patricia, good
morning
morning.
to-
We can't see you still.
Good morning to everyone. Good morning here in Colombia. Good afternoon there in India.
Right. It's
Yes, you
already
know,
evening
here-
for us.
Sorry?
I'm saying it's already evening for us.
7:30.
Oh, okay,
Yeah.
good.
Yeah.
So good evening. Sorry, because I joined a little bit late because we are doing the PSD for ICE as well. But I'm so happy to be here. I think today is a great day. It's a so special day because we are so aware about patient safety. I think we have a great responsibility because our patients are so important for all of us. We have to be aware about pregnancy, about newborns. That's the special topic for this year, about WHO. But I think all patients are so special. We have to be aware about pediatricians, about our old patients. We have to be as prepared as we can. We have to study all days. We have to search for all the information we can, as we can, all the information as we can. We just have to be as good person as we can, because most of the time about patient safety, our patient just need to be listened. I have a lot of patients that they don't know how to use their medicines, because sometimes doctors and pharmacists, they don't have the time to listen them and to explain how to use the medicines. And this is all the problem. It's not about the efficacy, it's not about the security, it's about how to use their medicines. I think this is one of the most, of the biggest problems, sorry. And if we are aware about that situation, I think we can improve the communication with the patient, the risk communications. And that's because I love to talk with patients. You know, I love when I can to teach them how to use their medicines, and that is one of my favorite activities with patients. And this is one of our flags with the Colombian Association of Pharmacovigilance. We have to empower patients. We have to create leadership among the patients. And this is my message for today. We have to be as better person, as better professional as we can, and to encourage and to empower patients, and to tell them, come on, you're the patient, you are the owner of your medicine. You have to be as prepared as you can. It's not the responsibility of your couple or of your relatives. It's your responsibility. You as patient have to be your own leader. That's my message, and thank you so much. I'm so happy to see you, and I know this is a great effort that you are doing. My congratulations, and nothing, sorry.
Thank you so
I'm
much.
a little bit shy.
Now I would like to invite Dr. Jose Batista start to say something.
Hello, everyone. Once again, it's first of all, I would like to say that it's a honor. It's a big honor for me to be part of this amazing PV family. Thank you for keeping myself connecting with you. And well, in terms of our celebration, and in line with the words that already shared my colleagues, I just wanted to say that, well, when we think about patients, for sure, we need to think about how we can help them doing what we know to do, that is PV. And especially for the countries in which I am based, for middle income countries and middle income regions, well, one of the things that I frequently hear from the PV professionals are related with the lack of resources, with the lack of information. But my next question is that, well, this kind of, I can say, words or message will came from 10 years ago, came from 15 years ago. So I believe that we need to find new ways to face our new challenges, because at the end, we need to move forward doing PV. Why? Because as Dr. Luca mentioned, well, for sure, we have a big amount of data, and we need to consider that the value of the data that we can get is not determined in terms of where the data was collected. COVID-19 vaccines show us that some of the paradigms about local data are not really true, because we are using vaccines around the world that were not testing in our countries. And no big safety issues were found so far. No issues related with the with a negative impact in the benefit risk balance are detected so far. So I can say, and I would like to say that we need to move forward in a proactive way, trying to protect our patients with the things what we have. And our big weapon in PV is to start with the basis. I believe that these bases are related with communicate risk, especially in the Latin region. I could say that our patients, well, most of our patients in our countries, well, don't have access to the labels products. You can imagine how they are really so far to know in a formal way about the risk of the medications that they are taking. So I truly believe that as PV people, as PV person, we need to move forward trying to protect our patients, stopping to complain and doing something with what we have. So thank you so much for inviting me, and congratulations for the organizers of this amazing event. And for me, once again, it's a big pleasure to meet with you, at least in this virtual mode. And I believe and I hope that, well, next time, well, maybe next year, we could have another type of meeting, maybe.
Sure, sir. Sure.
Yeah, I'll keep the fingers crossed.
Yeah.
Thank you so
Thanks.
much, sir. Now
you.
I'd like to invite Dr. Ahmad Hegazi, sir, from UAE, so to say something. Hello. Are you there, sir? Dr. Ahmad, sir?
Yeah, Dr. Chinmay, till he's on the
Okay.
board, I have one query, kind of, International European Society of Pharmacovigilance.
Yes, sir.
So I think today in the morning, I came to know that now they're starting a Asia chapter.
Okay, sir.
So as a society, are we trying to collaborate with them, or you should just look into that?
Yes, sure, sir. Sure, sir.
Yeah. It's all off this topic, what is currently going on, but just it came to my mind.
Sure, sir. Sure, sir. We'll talk about that.
Like, we're also waiting to hear Alain Kut on this.
Alan, yes, sir. Hello.
Yeah.
Alan, sir, you can say.
Yes. Yes. Can you hear me?
Yes, sir.
Yes.
Yeah.
Perfect.
Yeah. Just I'm thinking about my role in France, and my first question about such a project is the language, because for the moment I think it's only in English,
Yes.
and
Yeah.
for patients in France it's so difficult to.
We can convert it into local language, sir. No issues with that.
We can
translate
yeah.
it. We can
And yes. Mm-hmm.
In the website
and
only, sir. Website only. It is option is there, sir. There we can change the there we can change the language, sir. So it is.
It's possible to change the language. Okay.
Yes.
The second point that the French agencies, French authorities, have also a link to notify, to declare any adverse events, either by patients or by healthcare professionals. Okay, and how can we do not to duplicate the efforts and the data? Okay, because how we can also advertise this project and invite patients to go to either to the application or to the website and to notify information about them. You know, in the SMPC in France, in the French version, in the section 448, we always add a section on how to declare an adverse event. Okay, go to French authority website, ANSM website, and declare them, and as well as in the leaflet. Okay, now they know through the leaflet and the SNPC how and where to declare. Okay, what we will do, not to duplicate the effort, first of all, and where can we advertise our project and invite patients to go to the website or to the application and declare them. Okay, that's a point I need to be clarified.
Sure, sir.
Yeah.
Look at that.
I think it's a very fair point, a very practical question that you have asked, Elaine. But I think when it comes to pharmacovigilance, what we have always been taught is it is better to have a reputation rather than missing out on, filing on one of the ICSR. So that is why I said that when we are issuing this card, definitely we are working on the HCP level. The HCPs are sensitized and we are making patient a part of it. But more importantly, it is not about the first time that the patient is seeing an adverse effect of a drug. It is more important that if he is visiting another specialist, then he should be carrying that card, or he should have this information, so that he can sensitize the other doctor not to repeat that same medication.
Okay.
So that is why, yeah, even if it means repeating, but then at the central level, when filtering is done and when the 4 identifiable factors, are available, so they are able to detect which case are we talking about, which patient or which adverse event from which drug are we talking about. So those kind of filtration are taken care of, in the process. But it is more important to report rather than worrying about the repetition, I think, at this point in time, especially.
Yeah, okay.
Yeah. Sure. All right. But thanks for the question. Yeah, I'm sure this is going to come as a practical issue.
Thank you.
Thank you, sir. Now I would like to invite Dr. Ahmad Hegazi, sir, from UAE. Hello, sir. Can you hear us, sir? I think he's there. Okay. Okay, now we will move into our next program, that is launching of a training program. So now I would like to invite Dr. Manoj Swaminathan, sir, he's the founder of BG Sir Foundation. So the stage is yours, sir. You can say something.
Wonderful. So thank you so much, Dr. Chinmay, and it is very exciting to be here, and also amidst the launch of the One Patient, One Card. So that's an amazing initiative, because all these years we were talking about something different, and that is about HCP reporting and so on. And with the COVID situation, everything has changed, where everybody is now talking about so there is a lot of awareness about pharmacovigilance these days. And with this, I also wanted to show one thing. Are you able to see my screen?
Yes, sir.
Yes.
Wonderful. So this is something which I came to know only today. And 1 second. Yes. So this is about the Pharmaceutical Society of Australia, and they have welcomed the first pharmacist-led vaccine pharmacovigilance system, exclusively led by pharmacists. And this is first time in the history of pharmacovigilance, because generally it is the practitioners and the physicians primarily. But this is something, it's going to be a landmark, I believe. And with this, I roll out the professional diploma course in pharmacovigilance. And this is something which I had proposed to Dr. Chinmay, and he was very happy to promote this and also to be a part of this, because unless people are trained on pharmacovigilance, it will not work. And Also, we need a lot of awareness among the healthcare professionals to begin with, and even the patients who will be next. So this is a collaborative effort between Vijayasa Foundation, which is a registered non-profit, and the Global Pharmacovigilance Society, that is a global PVS. And the representatives are there today. So we are going to have a professional diploma in pharmacovigilance program, which will be a 3-month long program, and we will have participants and also the trainers from both India and abroad. So how this course is going to be different, because you all know that there are so many pharmacovigilance courses going on in the industry, and some for profit and some for super profit. So nothing is not for profit. And this is going to be an holistic course where we are going to cover the practical aspects. We will also take care of the soft skills. Then we will also train them on how to prepare their CV, how to face an interview, and how to deal with the social media. If you want to sell yourself, then you need to use the social media. And LinkedIn is one such great example. And ultimately, the placement guidance will be providing them all the, or will equip them with all the things. Because nowadays what is happening is that most of the courses, they only focus on pharmacovigilance, and it is more for profit. And there is no holistic experience wherein people don't learn about how to deal with an interview, or how to talk to the interviewers and so on. So this is going to be slightly different. So we will have both national and international trainers, and most of them are there today. And we will have the course in 10 modules, and we will also have an optional research module with publishing assistance. The research can be published in the JPADR, and it will be a total of 40 credit hours. And it will be we were initially proposing a weekday course, 1 day every day, but now we are evaluating a weekend course, because many students have come back and said that weekend will be better than day, because they will have to spend 1 hour every day. Instead, if we can do it 2 hours over Saturday and Sunday, that will be amazing. So as we said, this is more about creating awareness and holistic training. We have priced it reasonably. It will be 10,000 rupees for the entire course. And we are starting the course on 1st of October 2021, which is only 2 weeks away. And I request you to contact us for more information, and we'll be more than happy to support. So once again, thanks JPADR, Global PVS, and Dr. Chinmay for supporting this. Thank you.
Thank you so much, sir. We'll definitely support you, and we will do whatever best for this society, like for the students who wish to join pharmacovigilance job, because many are asking questions like what to have to read and how we will get a job in PV. So we can address them through this training program also. We can address them. Thank you so much, sir. Now we will move into our third session. It is the international pencil art competitions. So around 34, as I said earlier, 34 participants taken the participation in this art competition. So this is the first one, Situ Sharma. I can show you these drawings here. Then I will announce the this is by Susan Philip. This is by Sachin. This is by Shubham Maharana. Then it is Shivam Maharana. And again the second picture of Shubham Maharana again. Then Situ Sharma. This one. Then Shivamurthy Nandura Prasad. So he has also described nicely about the Pharmacovigilance. That yeah. So this one is Swagatika Senapati. This one is from Akshay Balaji. So Amarnath. This is from Amarnath. This is from Pooja Thakur. And it is from Vishal Kumar Misra. Sunil Puri. Mona Lisa Mahanta. Sonalika Priyadarsani. Amrita Mistry. So Pavitra. Ramya Bharlakshmi. Then it is from Mukta Balraj. Yogeshwari. Then same, 3 arts come from here. Then Ansuri, he has submitted 5 arts. So these are the arts. So then Anup Swai. Then this one is from Yageshwari. So out of these, as I've told, so responses we got from many persons. We got the rest. So just a minute, I will show you the Excel sheet.
I must admit that for something serious like pharmacovigilance, still there have been people who are so creative and sometimes even funny. So that's great.
Yes. So the results I would like to announce. Before that, I will show you how much they have got the credit, the scores. So just a minute, I'm just watching that. It's not opened. Yes, here it is. So you can see the scores. Okay, 119, 119. So we have sent these drawings to many evaluators, and out of them they have collected the results. So responses. So the score, the highest score has been scored by Yageshwari. So she is the first winner, and then she's got the first position. Then 119, then 118 is from Akshay Balaji. Akshay Balaji is the second position. It's good. Then the third one is 112 Sachin. So Sachin has become the third winner. Okay, that is what so far. So results. I have already prepared their certificates, but I will have to send that one within after this event. We will send it right now. So these are the certificates. This is the first position, first place. So congratulations, Sai Yageshwari. If you are here, you can say something. Okay, this is this first one. Then this one is the Akshay B. She won the second position. Then this one is the third one, Sachin. So these 3 certificates will go to you within 10 minutes. It will go to you. So that is what, and rest of all participants, they have received, they will receive their e-participation certificates. And thank you so much for everyone who are here today, and thank you for joining our event. And I hope our first program, that is one patient, one PV card, will create a success, and we will, means it will, ma'am, you can say something if you please, ma'am.
Yeah. So obviously the objective is to bring the patients into the PV system, to empower the patient, to make them responsible for their own health, and sensitize them that what side effect means and how to safeguard themselves. So it is just an effort to bring them into the system. And also, when we are doing so, we are involving all the HCPs in this as well. So that is how, until unless we are creating the awareness at all the levels, all the HCPs, patients, regulatory, and government, we would say that we should not stop. We should work in that direction. So yeah, let's join hands and make all this success.
One more thing, ma'am, Dr. Dr. Dennis Richard, she's helping us in making the SOPs for our journal and things. So it is very good. And I would like to invite her to say something if she's there. Dr. Dennis Richard, ma'am. She's from South Africa. Hello. Are you there, ma'am? I don't know. She is there, but okay. Anyone else, if you want to add something, you can give us your suggestion or opinion on this ePV card. We'll be happy to listen to your suggestions, and we will implement if possible. If anyone wishes, you can say something.
Yes, I have a question about the system implementation of this ePV card. Well, I want to know if you looked to the contributing factors, because, for example, in India, I can imagine that it's a huge population. So you have a lack of systems, or maybe poor systems in place. So how the access to information will be, and how the guidance, the procedures, for example, we have also complex medicines. So how the patient will be aware of the test doses, or the concomitant therapy. So in order to boost the public engagement regarding safety and healthcare, we have here 4 domains of the challenge. So we have in the first place the healthcare professional, but how to convince the patient to cooperate with this HCP. And so I want to know about the access to this information. And for example, we have here multiple types of patients. We have the high risks, for example, for anticoagulation, for example. So how the follow-ups will be done. I want to know if you have implemented other program support for patients. So some, I don't know, some groups of pharmacists, or I don't know, other professionals will take this in charge. So how will be the procedure of this La Boucle?
Would you like to answer?
Well, I can talk about India. So what I'm aware is that if we talk about the institutions, then only 30% of the patients land up in government hospitals. 70% are corporate hospitals and private clinics, where patients like to go. And if we talk about the pharmacovigilance program of India, then as of now, it is mandated only in the medical college and hospitals. So I would say then that means we are restricting them only to a 30% coverage of the hospitals or the HCPs, where the doctors are aware and where they know the systems and processes of pharmacovigilance. And that is why, you know, when we created this society, when we came up with the journal, it was about bringing all the healthcare professionals in the system, highlighting that everybody has a role to play, because then if we are not reaching out to each and every healthcare professional, then there is a lot of leakage happening in the system and we are not able to catch all these cases. That is why, you know, we have been working in that direction. So I would say, yes, definitely, even in India, the system is not foolproof. We are covering a maximum of 30%. And even in that 30% healthcare professionals, it also, since spontaneous reporting is passive in nature, it depends upon, you know, the will, you know, how much is the individual HCP motivated to report, whether the HCP has time and whether the HCP understands that what is the importance of this. Because a lot of time healthcare professional thinks, oh, this side effect is too mild for me to report. Oh, this has been already reported so many times. You know, this is so serious, so people are aware, you know, the regulators are taking care of it. So there are so many myths, you know, or things that the HCP is not aware, and that is why we need to create awareness. We need to have trainings for them, and we need to reach out to the last standing, I would say, the doctor, the nurse, the dietitian, the paramedical staff. Everybody has to be covered up into this, right? That is one. Second point is when we talk about empowering the patient. For all ethical reasons, we cannot directly reach out to the patient. It is difficult. We can do that indirectly, you know, when we are doing any kind of awareness online, etc. But otherwise, obviously, we cannot reach out to the patient. It has to be directed to the route of the doctors only. So only when the doctor himself is aware and he is aware of this one patient, one ePV card, only then he will tell the patient that, you know, this is the new drug that I'm prescribing. This is the new medicine that you're getting for this particular disease. If you ever encounter any mild or moderate or severe side effect, then you can, you know, put the data in this, so that, you know, next time, so we understand that patients are suffering from comorbid condition. A hypertensive patient may also have diabetes, or a diabetic patient may also have cardiovascular problems. So there are so many medications going on. So the patient, when he is you know, knowledgeable about this card, he will be able to enter what kind of medicine he's taking. At the same time, we understand this patient cannot assess or evaluate that his new side effect is attributed, or his ADR is attributed to which drug. That's where I would say in the background, people who are working will be able to evaluate, put things in perspective. And after having a medical review or a pharmacovigilance review, we will be able to give him that a particular side effect in all probability is because of a certain drug. So that, you know, this patient, when he goes to any doctor, any other specialist in future, that same medication is not repeated. Let me again tell you, it may be futuristic approach, but it is better to be futuristic than to be left behind. So maybe it's like we are trying to do something new ahead of our times, but then I would say that we are all working here for a purpose. We are not doing jobs. We are not getting any money out of it, but it is for a certain purpose, because we want to make this world a safer place for everyone. So that is why we are trying to implement all the ideas which we think will make the medication safer and increase the credibility of the medicines and build the trust on pharmaceutical organizations and the regulators and government.
Okay, thank you.
Yep. Anybody else? I mean, if you have your points, I mean, Elaine had discussed a very practical issue of repetition, you know, if the patient is also reporting and the doctor is also reporting. Similarly, if any one of you have, you know, if you think any doubts or queries or suggestions, you know, it would be welcome, so that together we can brainstorm, you know, we can pick each other's brain and work on those areas. No, not yet. Okay, that's okay. Anytime, if there is anything, just let us know. Yeah, sure.
Thank you. Thank you, ma'am. So we will close this event today, and with a huge thanks from my side and from Global Pharmacovigilance Society. I would like to thank all the attendees here today, and thank you so much for joining us. And sure, we will think of some new ideas, and we will change, or we will implement some new things into this system to improve the pharmacovigilance program of India and also abroad also. So let's join hands together, and thank you so much, everyone. So today we will close this session today. Thank you. And we will be meeting very soon on 22nd. We are organizing a webinar with collaboration with SRM Medical College, Chennai. So that will be a great event again. So let's meet there again on 22nd. Thank you so much. I will stop.
Thank you so much, everyone. Stay safe.
Thank you for you all. Thank you. Bye-bye. Speak to you soon.
Stay safe. Bye-bye. Nice to see
Bye.
you.
Bye-bye.